Colorectal cancer often doesn't show many signs in its early stages, but there are some things that might give a hint. The actual symptoms may not appear until the cancer has gotten to stage 2 or later. To catch it early, it's a good idea for people over 50 or those under 50 with a higher risk or family history of this cancer to do regular screening tests, like a colonoscopy. It's essential to talk to a doctor about when you should begin these regular screenings for colorectal cancer as part of your health plan. Colorectal cancer refers to two types of cancer, colon cancer and rectal cancer. These two are grouped together because they are part of the lower digestive tract and share similarities. The colon stores waste, absorbs water, and processes food, while the rectum helps remove waste from the body. Most colorectal cancers start as small growths called polyps. Detecting and removing these polyps early through screening tests can prevent them from turning into cancer. Today, we'll discuss 6 symptoms of colorectal cancer, and this video will guide you in recognizing these early signs, potentially saving your life. Remember, this video is for educational purposes only and doesn't aim to replace your doctors. 1. Sudden weight loss. Sudden weight loss can serve as an early indicator of colon cancer due to several interconnected physiological mechanisms. Colon cancer can impair the normal functioning of the digestive system. Tumors in the colon can obstruct the passage of food, leading to decreased nutrient absorption. This, in turn, can result in a reduced caloric intake, leading to weight loss. Additionally, cancer cells can accelerate the body's metabolic rate, causing it to burn calories more quickly than usual, which can further contribute to weight loss. Moreover, colon cancer can induce a chronic state of inflammation in the body. This inflammatory response can stimulate the production of cytokines and other signaling molecules that promote muscle wasting and a loss of fat tissue. The body may also divert energy and nutrients to support the growing tumor at the expense of normal bodily functions, which can lead to weight loss. Additionally, as the tumor progresses, it can release chemicals and hormones that affect appetite and metabolism, exacerbating weight loss. Furthermore, the presence of blood in the stool, a common symptom of colon cancer, can lead to iron deficiency anemia. Anemia can cause fatigue, weakness, and a decrease in appetite, all of which can contribute to unintended weight loss. In summary, sudden weight loss in individuals with colon cancer can be attributed to a combination of factors, including decreased nutrient absorption, increased metabolic rate, chronic inflammation, diversion of nutrients to the tumor, and the indirect effects of anemia on appetite and overall well-being. So if you're currently losing weight left and right, it's better for you to go see the doctor. 2. Narrow ribbon-like stools. Narrow ribbon-like stool, also known as pencil-thin stool, can be an early clinical indicator of colon cancer due to the physiological changes that occur within the colon. The colon, or large intestine, plays a crucial role in the absorption of water and the formation of stool. In a healthy colon, the stool is typically soft and well-formed, allowing it to pass through the colon smoothly. However, when a tumor begins to develop in the colon, it can obstruct or narrow the passage for stool to pass through. This narrowing leads to the compression of the stool, causing it to become thinner in appearance. As colon cancer progresses, the tumor may continue to grow and block the colon even further, causing more severe narrowing of the stool. Additionally, tumors can invade the surrounding tissue, including the wall of the colon, which can further disrupt normal bowel movements. The narrowing of the stool is often accompanied by other symptoms such as changes in bowel habits, blood in the stool, and abdominal pain. These symptoms should not be ignored as they may indicate the presence of a potentially malignant growth within the colon. Therefore, early detection and medical evaluation are essential when such symptoms are observed, as they can help in the timely diagnosis and treatment of colon cancer, potentially improving the patient's prognosis. 3. Rectal bleeding, either bright or dark red in color. Rectal bleeding, whether it appears as bright red or dark red blood in the stool, can indeed serve as an early warning sign of colon cancer, and this phenomenon can be explained scientifically. The colon, also known as the large intestine, is responsible for absorbing water and nutrients from digested food, leaving behind waste material that is eventually expelled from the body. Normally, the inner lining of the colon is coated with a protective layer of mucus that shields it from damage. However, when cancerous growths develop in the colon, they can erode this protective layer. The erosion of the protective mucosal layer can lead to direct contact between the cancerous growth and the blood vessels within the colon wall. As a result, any disruption or damage to these blood vessels can cause bleeding. In the early stages of colon cancer, when the tumor is relatively small and localized, this bleeding may not be readily visible, but it can still mix with the stool. Bright red blood in the stool often indicates that the bleeding is occurring closer to the end of the colon or rectum, which can be an early sign of the disease. Dark red blood may suggest that the bleeding is occurring higher up in the colon. It's important to note that rectal bleeding can be caused by various factors other than colon cancer, including hemorrhoids, anal fissures, or gastrointestinal infection. However, when rectal bleeding is persistent, unexplained, or accompanied by other concerning symptoms like changes in bowel habits, abdominal pain, or unintended weight loss, it warrants prompt medical evaluation. 4. Tenesmus, which is the feeling of having to empty the bowel but nothing passes. Tenesmus, the sensation of needing to have a bowel movement even when there is no stool to pass, can be an early indicator of colon cancer, and this can be explained scientifically. In a healthy colon, the muscles work together to move stool through the intestines and out of the body. However, when colon cancer starts to develop, it can obstruct or block the normal flow of stool through the colon. This obstruction can create a feeling of fullness or pressure in the rectum, which is the lower part of the colon. As colon cancer progresses, the tumor can become larger and more invasive, further obstructing the colon's passage. This increased obstruction can lead to a stronger sense of tenesmus because the body is trying to push stool past the blockage. Additionally, the tumor can irritate the nerves in the colon's lining, contributing to the uncomfortable sensation of needing to empty the bowel even when there is no stool to pass. Tenesmus is often accompanied by other symptoms such as changes in bowel habits, rectal bleeding, abdominal pain, and unintended weight loss. When individuals experience persistent tenesmus, along with these other concerning signs, it is essential to seek medical attention promptly. 5. Anemia caused by iron deficiency. Iron deficiency anemia can serve as an early scientific indicator of colon cancer due to the intricate relationship between the digestive system, blood production, and nutrient absorption. In the body, the small intestine is responsible for absorbing essential nutrients, including iron, from the food we eat. Iron is a crucial component of hemoglobin, a protein in red blood cells that carries oxygen to all body tissues. When a tumor begins to develop in the colon, it can disrupt this normal absorption process. Colon cancer, particularly in its early stages, may not produce obvious symptoms related to the digestive tract. However, As the tumor grows and progresses, it can bleed intermittently. This bleeding may be in small amounts and not easily detectable by the naked eye. Over time, chronic, low-level bleeding can lead to a gradual loss of iron from the body, resulting in iron deficiency anemia. This condition occurs when the body lacks sufficient iron to produce an adequate number of healthy red blood cells, leading to fatigue, weakness, and pallor. Anemia caused by iron deficiency can be one of the first noticeable signs of colon cancer, making it a significant scientific marker for early detection. Since iron deficiency anemia can result from various other health conditions, it is crucial for individuals experiencing its symptoms such as fatigue, weakness, and paleness to undergo a thorough medical evaluation. 6. Persistent abdominal pain. Persistent abdominal pain can be an early clinical indicator of colon cancer, and this phenomenon can be explained scientifically. The colon, also known as the large intestine, is part of the digestive system responsible for processing and eliminating waste from the body. In the early stages of colon cancer, a tumor may begin to form in the lining of the colon. As the tumor grows, it can obstruct the normal flow of digested material through the colon, leading to intermittent or persistent abdominal discomfort. The abdominal pain associated with colon cancer can be caused by several mechanisms. Firstly, the tumor itself can exert pressure on the colon's inner lining, leading to pain and discomfort. Secondly, as the tumor enlarges, it can disrupt the normal contractions of the colon's muscles, resulting in cramping and pain. Additionally, if the tumor causes an obstruction in the colon, it can lead to a buildup of gas and stool above the blockage, causing distension and discomfort. Persistent abdominal pain, especially when it is accompanied by other concerning symptoms such as changes in bowel habits, rectal bleeding, or unintended weight loss, should not be ignored. Those were the 6 early signs of colon cancer. Make sure you subscribe to the channel and share with your fellow age friends. Thank you.